afternoon, all. Welcome to PHYSIO TV. So today we have a topic that has, I think, mostly all of the clinicians, all of the physiotherapists are around India and the world are, I wouldn't want to say battling, but yeah, we are always in the quicksand of the evidence-based practice. Today we have Dr. Prashant Mukkannavar from, he's a principal and professor at KLE College of Physiotherapy, Hubballi. He holds a PhD in physiotherapy and he is been, of course, a principal now. He is also an adjunct faculty of MGM School of Physiotherapy, MGM University, Aurangabad, Maharashtra. He possesses over 20 years of experience in all clinical and administrative facets of physical therapy profession. He has received the International Association for the Study of Pain in Developing Countries project grants in the year 2020, 2022 and 2023. He has published many papers in reputed international and national journals and has been serving as an editorial board member of the repute. He has won Best Research Award at 3rd International Health and Fitness Conference on Sports Injuries and Rehabilitation. Again, to add more to his crown, he has been guiding or has guided 20 postgraduate students. His research and clinical interests are persistent with patients with chronic pain, women's health, pain science, sports rehabilitation, and evidence-based practice in musculoskeletal pain. Sir has also been a member and speaker for many conferences, seminars, and webinars as well. We welcome you, sir.
Yeah, thank you so much for that introduction. Quite big one. I really thank Sancheti Hospital and the Physiotherapy College by giving me this opportunity, and for the even I want to thank PHYSIO TV for this wonderful concept of sharing the knowledge with across the world for physiotherapy betterment. Today I have taken this topic based on the basic part of evidence-based practice and the critical thinking. So how exactly we need to come with the point of whenever we talk about any part of the evidence-based practice or clinical reasoning, one need to have these kind of concepts, which is a basic one, where we usually find, especially the newcomers, are struggling to get the idea behind what works for their patients. So moving on to the basic introduction part of critical thinking, we always, as you can see in the screen, I think I'll give a little bit of pause to make you read that line of title, so that you'll understand what exactly they're trying to say. Effect of respiratory muscle training session on ankle muscle activity in athletes with chronic low back pain performing overhead squats and randomized control trial. So such kind of publication always comes in the picture of while doing the review of literature. It always puzzles for everyone what's going on with this kind of article and this kind of title, where quite confusing and quite misleading kind of a concept is happening around. So how to authenticate ourselves that what's the genuine one in this kind of articles, where we tend to do the review of literature, or when you search for articles, especially the postgraduate students and newcomers who really struggle to understand the concept of the critical thinking in this kind of a concept and in this kind of articles. It's always, you need to remember that whenever we talk about anything with the knowledge behind thinking, one need to understand already whenever we know already knowledge we have, but when the new knowledge comes, it's very difficult for a person to think that already what he knows about it. It means what, in short, quite sometimes it's quite kind of a bias it's created in our mind that when I already know certain things, why I'm listening this kind of a concept. Usually what happens, we have seen that whenever a new idea, new concept, kind of in the research field, in the new kind of a innovation in physiotherapy, always we find that the genuinity of that concept, genuinity of that treatment, or genuinity of that kind of evidence-based articles, we need to have special skills to understand that. We know that the most resilient parasite, we call it as idea. Okay, it's called contagious. If you are stuck with the idea, it might enhance your knowledge, or it might again destroy you with respect to the what is genuinity of that knowledge with respect to that idea. So my point is here to make you a little bit of sensitized related to the critical thinking process. We have seen that there are so many hierarchies of categorizing the evidence-based practice. As you can see in the slide, if we go with the hierarchy part of the highest level of evidence is meta-analysis and systematic review. Subsequently, the next part is RCT trials, cohort study, case control study, cross-sectional study, and case report. And last but not least, that is anecdotal or expert opinion. So when we are really want to understand, when you are reading certain things, we need to dig into these kind of various designs and synthesize the whole research and make ourselves get acquainted with kind of a new concept, what's going on with the new research and new updates of evidence-based practice. For that, certain ingredients are required, so that I'm trying to convey the message that how exactly we use this critical thinking process to get ourselves updated, and the previous knowledge can be shared and questioned, or update ourselves with respect to the new knowledge of the concept. Critical thinking process is always needed for all our professional life. It's not going to end when I studied my undergraduate, postgraduate, or PhD also. It's ongoing process, even for clinicians who already completed their graduation, post-graduation, or doctoral degrees. There's always learning never ends. We should remember that learning never ends. So to understand effective thinking process, it's not a mystery part of it. We require a little bit of practical skills to learn and to practice to improve ourselves into day-to-day practice of physiotherapy. The critical thinking process offers the skills to anyone willing to do the work to acquire them. Remember that part. This I have taken from the Critical Foundation organization, where they have given a beautiful definition of critical thinking process. One need to remember that technique and the approach utilized does not matter as much as the critical thinking and clinical reasoning behind it. I was talking about whatever day-to-day life we are using the different reasoning skills for same modality or same concept of exercise or same concept of approach has a different reasoning and the different meanings are there. So one need to get into the business of how exactly the scientifically sound thinking is going on when we apply certain things. One need to remember the trait of critical thinking process. Always we need to reflect our thinking process, and we need to question based on the reliability, validity, and overall relevance of findings and interpretations which we are reading day-to-day life. Especially the critical thinking process with respect to review of literature and the reasoning process, how things work is quite evident for us. We need to get into the business of how exactly we need to develop these skills and with our own knowledge when we are applying the things on the patients. So what is exactly the critical thinking process is all about? The critical thinking process, nothing but to those of cognitive skills are required to strategize that increase the probability of desirable outcomes. We always use so many reasoning skills, so many modalities we apply, and we have some certain kind of an explanation how things are working there. Actually, the critical thinking process is nothing but systematic evaluation of claims, beliefs using the knowledge of science with the logic, and argumentation theory on logical fallacies and cognitive biases. So all together, we need to understand where we are failing in our process of thinking, and what is the new thing we need to adopt in our thinking process of how things are working over there. Critical thinking is a process where the purpose is to make better conclusions that are independent of one's own and other people's beliefs. That's what we are trying to do in the day-to-day life of clinical management part of patients. Usually, the critical thinking process is a mode of thinking. It requires quite thinking by skillfully analyzing, assessing, and reconstructing the thought process on what we are doing, how we are doing, how it works. When we tend to have this kind of a corrective way of understanding and questioning, definitely we are in the right track of thinking process. It presupposes the assent to rigorous standards of excellence and mindful command to their use. It entails effective communication and problem solving abilities. So it channelizes the whole part of your thinking process to get the facts correctly when we are reasoning the things, when we apply things on the patients. Of course, it requires lot of cognitive skills. You know, one need to aware of what are our own setbacks, errors we make of giving the reasoning process during the explanation to the patient, explanation to the students or colleagues or physicians, fellow physicians, or to the whole world when we publish the whole part of the research. We always come across lot of common thinking errors, such as cognitive dissonance. The cognitive dissonance are quite hardcore belief of any person. You know, whenever we study undergraduate, I'll give an example of ultrasound, right? So when we studied at the second year topic that, okay, ultrasound is the best source for the pain treatment during the second year process. As we move on to the part of final year and post-graduation, we'll come across that, okay, ultrasound, there are other alternative methods which also relieves the pain. So what is wrong with ultrasound where my thinking was previously based on that? So when we get into the business of changing our process from ultrasound relieves the pain, so we need to dig into the whole part of how things work. And previously my professor have taught so many things that it has been mentioned in the electrotherapy part of latest electrotherapy that there is a pain relieving kind of a effect is happening around with the ultrasound. But have we questioned that part of reference or citation or cited references for ultrasound relieving the pain? So this becomes more of, again, thinking process where I'm giving you just example so that I'm giving you a smallest example so that you can able to understand where we are stuck. So when we look into those kind of a citation, we never come across any particular reference over there in the electrotherapy part of, especially the Clayton therapy book. So as we move on, so we understood that, okay, there's something called as I never learned during my undergraduate process. Probably I need to learn now, recatch up the whole thing part of my own cognitive dissonance, where I need to understand and rationalize and the new adaptable, evolving kind of evidence need to be accepted from my end. Remember, we all are biased. Nobody can, say that I'm not biased kind of thing. So you think for a while, what exactly you are trying to give, or what you're trying to reasoning out. So first check your biases, check your errors, check your cognitive dissonance, how much you know, how much you need to change yourself of new thinking process of any kind of a treatment part of it. There are certain kind of biases exist, cognitive biases and confirmation biases. These are the quite dearest for any physios who always has this kind of a bias they make all the time. I'm not saying everybody, but sometimes happens because of our own ignorance. Cognitive bias is always a systematic errors predisposes to the one thinking in a favor of a certain viewpoint. So we have a certain viewpoint towards certain XYZ modalities, certain XYZ exercises, operation, or whatever kind of you can say that. Sometimes a confirmation bias. This is quite usually we come across during the process of treatment. Sometimes I'm very much favoring towards the which I've seen the observation of phenomena when I applied XYZ modality. For example, take it the example of ultrasound. I have applied ultrasound on the patient and I got the results, beautiful result that it reduces the pain. Someone also claimed that when I applied ultrasound without the increasing intensity, so they also got the results. Now you might be confused yourself that two statements, the two versions, the two opinions of the therapist, how it differed and how it works. So that's what the thinking process starts now. No, one need to understand the tendency of search for or interpret the information confirms the own perception. This is nothing but the confirmation bias. While ignoring information which does not support the preconceptions. Usually happens for everybody. It happens when I do XYZ treatment, I got the results, and we don't know actually how things work. So now the critical thinking process comes in the picture of how to eliminate these kind of biases. Of course, there are a lot of other biases exist: attribution bias, availability bias, ambiguity bias, and representativeness of bias. I'm not going to technically in depth of it. Usually, the anecdotal and selective observations are quite challenging, especially the attribution bias. People have their own experience. They talk on that biases when while giving the information, while giving the applying the treatment, while giving the reasoning process of it. So it's quite dangerous. That is, it has to be questioned, and one need to aware of such kind of biases before we make our own conclusion out of it. There are certain other biases, like something called as sunken cost bias. This is nothing but clinicians may persist with a low value care. Although we know that ultrasound is not going to benefit in the long term effect, but still people want to insist, and they want to convince the patient, yes, it's going to work like that. It really challenges for the time, effort, resources, and training after and invested part of this kind of application methods. So because I have learned in certain workshops, I want to apply this on every part of the patient. So that's what exactly challenging comes with the picture of new learning process of it. So one need to question what I have learned, whether really it makes a sense of evidence-based practice, whether it really has some biases or some kind of a controversial kind of statements already exist in the literature kind of thing. So one need to explore these phenomena during your thinking process. There are kind of a biases of peculiar groups also exist. Some people are very much favoring towards the manual therapy. Some people are very much favoring towards the exercise therapy. Some people are very much favoring towards the electrotherapy part of it. So one need to aware of such groups, how they're pitching in during the CE workshops or conferences or presentations. One need to be very much keen into understanding what they're trying to say and what they are claiming. Okay, whether the claims are really as per the available literature, one need to dig into those areas also. So it's a quite challenging. Every now and then we need to think about these areas of process of thinking, whatever we have learned so far. There are certain kind of thing exist for every physio. We have certain kind of a DRS kind of a treatment, whether it's a pain science or whether it's a electrotherapy modality or dry needling, taping, or exercise therapy part of it, or Pilates. We call it a teddy bear effect. So we want to apply because I have seen many patients on my patient that this kind of going to work on this kind of condition. So we call it as a teddy bear effect. Want to be very much aware and careful about this kind of a teddy bear effect, which is very dangerous to every person. And there are certain kind of bias exist. The conclusion versus the process. Our thinking approach should always focus on the process and of being of less wrong. Always need to be less wrong. We can't avoid with our own biases. We should always be willing to update and change our conclusions whenever new information comes of it. Okay, we should try to very hard to test our assumptions and conclusion. Always challenge your own assumptions, challenge your own biases. Then only we can able to learn and receive new information easily. Conclusion versus the process is always the upper edge. It gives the understanding of how much we are willing to update and change our conclusion part of it. How much we are fixed with our own conclusion, how we need to change that part of it. How much we are less wrong, and how we need to change and improvise every time when we think about the process of it. Usually we need to have our own alternative hypothesis, not with our own DRS hypothesis part of it. So one need to really look into those biases, which give a sense of where we are going wrong and where we are heading correctly in a process of managing the patient, or we are giving information to the world. Usually happens that I know I'm right. This kind of always error happens when we debate, when we discuss, or when we try to put our own self in the upper zone of I always add in terms of pitching our own modality. So we should be very careful about making the firm conclusion and theorizing before one has done the critical evaluation. One need to do critical evaluation and look into scientific evidence very closely. as far as possible, we need to avoid errors. So one need to be aware of how things work, what are the limitations of application of certain kind of a modality, techniques, or understanding the concepts. So always try to avoid yourself in this kind of zone. There is a last part of bias I'm trying to talk about is outcome measures and the post hoc reasoning. The post hoc reasoning is very simple that we this is the common most thinking process errors we call it as. The error will be a logical error. We call it a post hoc ergo propter hoc reasoning kind of thing. We conclude, example, if I apply ultrasound and we saw that the phenomena is like it reduces the pain. But this observation, although I have detuned it, I have not increased the intensity, but still the patient found that, okay, the reduction in the pain. Now, this is the conclusion. I applied certain thing XYZ and I saw the phenomena of observed phenomena is that it's a reduction in the pain. So this is called as post hoc reasoning without understanding how things are working over there. So we need to eliminate this kind of a direct application, observed phenomena after applying certain things. There are certain things, positive outcomes, and no, always we pitch in, certain times I practice and I have studied and certified so many things, and in the particular kind of a CE workshop, whatever we call it as, usually we get trapped of our own explanation that I know it exists, I know it's going to work. Like this kind of information we disclose to the patient or your colleagues, your friends. So one need to be very, very, very careful about what we are trying to say over there, because they are not being validated in terms of the respect to the scientific evidences. So remember, any outcome we want to choose it, should not be influenced, or sometimes they make influenced by many other factors. For example, pain. If I take a pain example, pain can be multifactorial, but still, when I apply certain XYZ modality, we'll try to say that, okay, after application of certain XYZ modality, it has worked like that. So be careful about this kind of an explanation when you're trying to give. So we need to really, really aware of our own thinking process, what I'm trying to say, what are my conclusions, and what are my limitations of my own conclusion out of it. So this is what exactly I'm trying to talk about in this critical thinking process. One need to be aware of our own biases and what are the biases which are going to created when we try to reasoning our own part of the explanation part of it. The next part of the critical thinking process is the concept of called as epistemology. This is quite important for anybody. Everybody has their own philosophy of trying to say that, okay, based on my philosophy, it will work like that. We have that kind of a hypothesized kind of a concept we have. Now, one need to understand how the knowledge is gathering when I'm trying to say a firm conclusion about it. The epistemology gives an understanding of the branch of philosophy where how the knowledge is developed, how knowledge is created previously based on the research part of it. It tends to attempt to answer the basic question, what distinguishes the true knowledge and what is the false knowledge kind of thing. How knowledge is relates to the truth, belief, and justification. So epistemology always has to be there in the one's own reasoning process of it. Okay, and always, of course, the skepticism is always the biggest thing. We need to have a differentiation between the epistemology and the skepticism separately like that. Whenever you try to say about any claims kind of thing. Remember one thing, that the epistemology is but the theory of a knowledge, especially with regards to its methods, validity, and scope. It also deals with the investigation of what distinguishes justified belief from own opinion. So belief and opinion always a part of our thinking process. So that's what we need to try to get the part of epistemology process of how we are reasoning it out. What are our own beliefs? I'll give one more example here, small example again with the respect to ultrasound. Now, how ultrasound sound waves are going to reduce the pain? If I challenge this question, probably we never come across this kind of a knowledge in the previously published articles. Nothing is there. It's not at all exist only over there. The sound wave is going to reduce the pain. It might reduce based on the certain kind of a reasoning process, which has been told already that placebo kind of effect is happening around there. Okay. Sometimes placebo really works in certain situation where we fail to understand this placebo effect every now and then. So one need to be exploring this phenomena of placebo and understanding the epistemology behind the concept of it. The epistemology gives the idea about, okay, things will work based on certain kind of a concept called nocebo, placebo kind of effects kind of thing. I'm just giving you example, a small example of make you understand about epistemology concept kind of thing. So how to question now? Where the knowledge is coming now? If I read certain articles, okay, this knowledge is talking about, it's saying the one particular reference, okay, this is what exactly they're trying to explain based on their observed phenomena. So we need to understand the knowledge previously, how it got it, how they are pitching this kind of a knowledge, how this knowledge was acquired, whether the sound scientific background was there, sound scientific kind of a method was used, and what do people really know about it? How do we know, and what we know? So we need to be question ourselves, how much I know about it, right? Is it a trustworthy information I'm gathering it when I'm searching my own articles, or certain times when I'm listening to certain podcasts, certain times I'm observing the webinars? All those things we need to be questioned, okay, based on my own thing. Right? Should I believe this? How much I already know the information which already been published? And whether it's opinionated, whether it's experience based only, whether it's a knowledge based or it's a wisdom based. So these kind of questions always put ahead of our thing, like reasoning part of it. Epistemological questions always have to be there in our mind. Yes, this I need to understand through these kind of questions. The next concept I wanted to talk about is, and the critical thinking process is plausibility. The plausibility is nothing but essential application of existing and basic clinical science to new hypotheses. Whether the idea behind application of certain XYZ modality really works like that, so that becomes questionable of understanding the plausibility part of it. It gives us a sense of idea how likely it is to be true. What are the likely that I'm trying to claim myself that it is really true, 100% true that it's going to work like that. So plausibility is the biggest challenging aspect of physiotherapy part of it. So when you pick up any XYZ and try to pitch in for epistemology and plausibility, you'll understand how the knowledge was developed, whether the knowledge was really trustworthy, is a truthful one, how much to trust, what are the other contradicting factors with that kind of knowledge. So one need to dig into those areas of plausibility and epistemology. Further, the plausibility helps us to interpret the clinical literature and also to establish the research priorities. So this gives a real sense for every academician, okay, when he's disseminating his own part of in the classroom, that he is talking about how things are working there. So this plausibility always gives upper edge for what's going on with the concept of how things are working there. Plausibility is nothing but the ultimate. It's not the ultimate arbitrator or of the clinical truth. It must be put in the context. So every context it differs. Now you must be wondering, I have seen in my practice, many people tell that, okay, patient wanted that this modality only. That his belief into that modality is that I want this modality XYZ. It's going to be a very much helpful way. Even though you're applying moisture or ultrasound, but still patient finds very much relief with that way. Now, excuse me. Now, this kind of a context where patients demanding that kind of a modality, although you know that it's not going to work like that, it maybe works in the part of belief, maybe part of the plausibility of the placebo effect, or something else is happening on with the context. So context is the key part of applying this plausibility idea, how things are working. So never forget this context-based kind of understanding the knowledge, how things are going to work. Usually the biological plausibility, I am wanted to give one more example. We know that already that carcinogens from cigarette smoke deposits in the lung over a period of time leading to lung cancer. Yes, we can't deny the facts. Yes, but what happens now? We know that, okay, there are other kind of a deposits also causes the lung cancer. So we need not get into that, okay, only because of the smoking leads to lung cancer. No, there are a lot of other things are there. So plausibility gives a sense of, okay, this is the one knowledge which we are gaining from the carcinogen. There are other knowledge also exists that something also affecting the cancer. Sometimes what happens, if there is no evidence exists, particularly in the area of health and medical research, then you must be considering the first whether the claim someone makes the biological plausibility. So one need to question when the evidence does not exist only. So you have to question the plausibility idea, how things are going to work. You need to ask a specific question like, does this claim make basic scientific sense? If there is any doubt involved, I suggest to choose to doubt again further. So one need to have this kind of a skeptical mind, an open mind, that how things are going to work. Question that first. Like I wanted to quote this Professor Wall, famously quoted, like, we still have way too many fantasy explanations that are used as support for real phenomena, that does not hold up the rigorous scientific scrutiny. So this is what exactly even the Professor Wall, when he started, I think in his experimentation, he saw that the part of phantom limb pain. I hope everybody know about this phantom limb pain. So even before that, the pain gate explanation. Okay, he gave the pain gate explanation part of it, and later he redefined explanation for pain gate concept. Okay, based on the phantom phenomena of pain. Okay, so gate phenomena, gate control theory is the one concept, and he has moved on to next concept of how things work in the hierarchy part of it. I'm just giving you an idea. So how he evolved and he's changed his concept of explanation in certain conditions. So I was talking about, we still have so many fantasy explanation that are used as support for real phenomena, So the Professor Wall already changed his concept of pain gate theory, which has the limitations in the phenomena of this phantom limb theory, So that's what one need to move from the pain control theory, So there are so many other explanations for pain. So this one I'm giving the example of how the things are evolving every now and then. One need to aware of logical fallacy. It's a fundamentally an error in logic when we apply the reasoning skills, reasoning part of the skill, the day-to-day life of explanation things. So one need to have very sound logical kind of a concept when we're explaining. Sometimes what happens during the part of logical processing thinking or logical fallacy always takes place where error happens when explaining certain things. There are a lot of logical fallacy happens, as you can see on the screen, that so many. I don't want to go into depth of technical part of explanation of these areas. Strawman, post hoc. The most usually we come across this post hoc reasoning and ad hominem. Okay, these two are most common whenever we go for any debate, conference kind of a event. We usually we'll land up in this kind of reasoning process that on observed phenomena has resulted to because of certain kind of application of certain exercise and modalities. There are certain kind of a thing which we tend to come across that ad hominem kind of a logical fallacy. We tend to criticize a person where we won't accept his kind of explanation, So we always do this kind of a explanation. We always never accept the part which the person is trying to say, and we always criticize based on his previous kind of acts. So this kind of logical error happens during the argumentation, or you can say that discussion. So one need to avoid such kind of fallacies. I'm just giving you an idea where I'm not going in depth of this kind of fallacies, but I'm giving an idea how we need to avoid this kind of a logical fallacy kind of thing. Sometimes we need to avoid this kind of it works for me gambit. It always works for me when I apply X, Y, Z again. I'm not going to depth of that. But here two concepts we need to remember. Those are quite essential. The first concept of thinking process is natural history of disease and regression to mean. These two concepts are quite essential whenever we need to consider when we are claiming ourselves, for any kind of a pain relieving kind of a concept. I'm just giving you a MSK part of example. The natural history of disease is nothing but biological real symptoms of disorder commonly diminishes, or no matter how they are treated. Even you don't treat, the phenomena is going to come down. For example, common cold. There is no, I'm just giving you a general example so that the common cold doesn't have a specific drug for everyone. Sometimes people take, sometimes people don't take. Still also the common cold going to come down. So one need to observe every condition, what is the natural course of disease, despite we want to give application of modality, we are going to try to give it to the patient. There one more example I wanted to give you, regression to mean. To explain this thing, nothing but whenever patient comes to us, he always comes with a concept of, whenever his symptoms are quite peak, highest level of symptoms are happening around. The many clinical signs and symptoms when measured through a time, there is always increase in the symptoms and always decrease in the symptoms. So this kind of a bell phenomenon of curve, always we call it as, sloping curve or bell curve, which always gives a sense of, we observe this kind of a concept, like a pain concept I'm talking about. Usually patient always tells that, okay, for example, third day or fourth day of his pain, it has reached to its peak level. And in that particular fourth day or third day, when I apply any part of a treatment, and we find that results are very astonishing. We get that very good results. But even if you don't apply, the next peak element, the next day or subsequent days, it might also reduces also without application of the modality. So one need to aware of with the treatment or without the treatment, the measures of such properties are going to reduce. So one need to aware of the regression. It reaches the concept of symptoms and reduces symptoms also. It's going to reduce this. So one need to aware of during the reasoning process of regression to mean how things are going to work. So these two concepts are quite essential for physios to make them aware that every condition has its own limitations. It reaches its peak, it's going to come down. So when you claim yourself, be aware of this, how it works for the kind of concept under two brackets, natural history and regression to mean. Sometimes so many people claim so many kind of grandiose claims they make it, without any evidences. And one need to be aware of how much evidence they're going to back up. So again, it puts a lot of reading stuff for all the clinicians and physios. Okay, whatever they claim, one need to read and one need to accept, deny, or reject it. It's onus on us how much to understand, how much to be understood, or how much the concept really exists with a new concept of knowledge coming out. This is a beautiful paper. I wanted to share this, that key concepts that people need to understand to assess claims about treatment effects. I think one really has to read and go through this kind of a paper, where I just wanted to give an example of this, where they talk about every concept in the left-hand side. I can just give you, I am highlighting here. The treatments may be harmful. Okay, they're given explanation at certain times. A treatment outcome may be associated with the treatment of not based on cause of the treatment, personal experiences, what happens to that concept. So every concept they have synthesized in this kind of article. I think it gives a sense of explanation with the examples indication. So this is the best article for any critical thinkers to, the giving the reasoning or you're reading certain kind of concept. I think you should go through that kind of a concept. Here, one more thing I want to highlight here in the slide. The new brand named or any expensive modality we are seeing in the day-to-day market, one should not get in the fad of, okay, this is a new treatment coming without any evidences and we want to apply it. So one should be very careful with nowadays the Consumer Act is very much evident that patients are aware of Google, and one need to be very careful when we are discussing the conclusion, applying the modality and reasoning the skills, how things are working. So the disclosure of the evidence to the patient is quite mandatory. I never see this kind of disclosure in Indian real context. Okay, so if somebody is already patient party is already aware of Consumer Act, then definitely you should be very aware of this kind of what you're going to say with the patient. So be careful about when you disclose the information. You should always disclose the correct information when you are talking about certain kind of concepts or when you're delivering the treatment part of it. Always remember, the product is not so important. The process is always important. So critical thinking process gives a sense how things are working, and the clinical reasoning part of it. Always remember, we always look into those special techniques, special exercises, special tools, special modalities, special mechanics, and operator kind of process, But there are so many things apart from modality, certain things also work, the way we communicate, the way we understand the person, way we interact in that particular context also influences the modality, also influences the treatment part of it. So please try to understand and balance yourself regarding product and the process, how things should be working. So this I'm giving example. Why to do the treatment, when to do the treatment, intensity of treatment, volume of treatment, explanation of treatment, and how do you carry that information, how do you communicate that information patient also matters. So critical thinking process is nothing but communication skills, and clinical reasoning process also matters over there, So So one need to have this kind of a standards in our own thinking. One need to have good clarity in our thinking, accuracy, precision, relevance, depth, breadth, logic, significance, and fairness of the knowledge. So each bracket, you can see so many questions, how much I do. If I question myself of understanding certain phenomena, concepts, if I question with my clarity, could you elaborate further? If you ask these kind of questions, they're not able to understand. Accuracy. So how much we can believe in that accuracy of information one who's trying to pitch in, or one who's going to publish through their research article, and the precision. So all these questions help you to understand assessing the thinking process of yours, where you stand right now after assessing this kind of questions, after knowing this kind of knowledge. So always question this kind of headings under your own thinking process that help you to learn new things about new concept with a different explanation part of it. So now what to do? How exactly I need to understand, and I need to think my own thinking ability now. I need to question myself. Always have this kind of a concept of learn how humans think by default. How much you are biased, how much you can be willing to change your own biased things when you're trying to talk about conclusion part of it. All right. I was talking about this process of thinking process: clarity, accuracy, precision, relevancy, depth and breadth, and logic of significance and fairness. So one need to get into this kind of sorry, I moved it. One need to understand the level of assessing the thinking process or questioning yourself, how much my own belief of knowledge exists based on these different headings under that. Of course, these are just a short points, bullets. I'm just trying to share that. But one need to have clarity, correctly, and accuracy and precision, because usually whenever we read any kind of literature review, any kind of experimental trial, one really have to know what are my skills to be to be developed with respect to the every article when I'm going to read. Whatever observation I'm doing in the marketing kind of thing, where I'm observing certain things in the TV commercial ad or in the workshop ads or whatever. First, you need to understand how much I know, whether the knowledge already exists, whether I need to change myself, or whatever the things has been dealt, or somebody is disclosing the information, and whether their accuracies really exist. So one need to question based on these different concepts of thinking ability, different concept points over here. So what to do now? You need to have to learn this default mode of thinking. You need to prevent that bias mode kind of approach. One need to understand logical fallacies, cognitive biases, and one need to have a good mentor. I think finding mentor is also important. Expertise, we call it as, also important, one who already published, and one need to understand the critical thinking process of questioning it, how to critique the thought process of yourself. Prove yourself always wrong. I'm always advise that you have to prove yourself always wrong with your own claims. That's how we need to learn. We need to understand and move to the next part of our knowledge process. Always we need to understand how the debate is going on, how the discussion is going on, and one need to reflect our own thinking process and assessing that. So unless discussion, communication, we are not going to move one point to another point. We need to change our own knowledge. So one need to understand whatever points I have discussed just now in the critical thinking part of it might help you to build up your own of thinking ability, of thinking process part of it. Remember one thing, that questions always lead to more questions. Inquiry breeds the more inquiry. Disagreement forms the foundation of debate. So always we may get into the entangle with the debate or discussion. So always understand your own ignorance part of it. So your own belief also important part of that. There's a famous effect, we call it as decay effect. I just wanted to share that. Usually, whenever who expertise, they call themselves expertise. The smartest people always say that they are always comfortable with the questioning. They sometimes they always you see that I don't know the kind of, they also always tell that. Okay, they never say that I know everything part of it. Usually, we see this kind of a decay effect when undergraduate person start practicing, and they say that I can manage every patient kind of thing. So I think that's the beginning part of this curve, that I know everything part of. The moment you get the knowledge, You understood that where you ignorance is failed, and you learn new things. Probably the curve is going to move towards the less complicated, and usually you'll become more expert in that kind of thing. Concept of you become more confidence, or you can say that uncertainty is most acceptable part than certainty part of it. We have seen many times that many users share their articles, share their concepts, ideas, and kind of thing. So if somebody questions, somebody like this kind of I think the self-explanatory part of the slide can say that one need to question that, okay, before you repost anything or share anything, you need to assess your own biases, assess your claims with the sound scientific knowledge. So we should have humbly knowledge our own limits and try to overcome by seeking of good information. And we need to test all our ideas and beliefs every now and then. How much it really trustworthy what we are questioning part of our own belief system. That's how I'm trying to put my perspective in terms of a critical thinking process for this kind of concept day-to-day life we are coming across. Thank you so much for your time. I think I'm in time, though it is a technical glitch over there. And I thank all the technical support and the faculties who really supported and gave me opportunity of explaining my part of critical thinking process for physios. Thank you so much.
Hello, sir. Thank you so much for being here and accepting the invitation for the talk.
Any questions?
Also, this is because most of our viewers today were the master students here.
Okay.
So we understand that it is always easier for them to understand now how to plan their management, or they come across a lot of recent advances, a lot of recent articles that they have been going through to find out new ideas to actually come up and manage the symptoms of a patient. But I guess they have some direction now to actually go through that, even if they have to weigh the evidence-based approach, how to actually critically use them, which is very important. Also, I would like to know if anyone else has any questions.
Yeah, please.
They might have really understood everything, or they have already started critically analyzing their knowledge now. Okay, thank you so much, sir.
Yeah,
Thank you for your time and your knowledge. Hoping to have such further ventures together more.
thank you so much.
Thank you so much. Have a good day.